I know how to do it.
Yes, you do.
I got rhythm. My name is Dr. Harvey Lapin. I used to be a dentist, practiced 52 years. And I want to thank, most of all, I'm a father of a 48-year-old man with the challenge of autism. But I want to thank this committee for doing this today. I want to thank the state of California for passing the self-determination law. And most of all, Senator Mitchell, I want to thank you for being a co-sponsor on that law. It really is a civil rights law. It empowers the customer, and that's what it's all about. But I want to mention one thing. When we were talking about health and safety, been knocking around the system since 1971. I never knew this, that the health and safety waiver is attached to an agency, not a human being. So if you decide to switch an agency, you have to go through the whole process again, which is timely and really could put people in harm's way. I would appreciate people to look at that. It doesn't make sense. Health and safety is a person.
Thank you very much. Next witness, please.
Hi, my name is Jackie Dillard-Foss. The health and safety waiver, I wanted to talk specifically about that. The process for a person in crisis, when they're trying to achieve the health and safety waiver, crisis is right now, and it keeps going and going. So I'm talking about the gentleman, we just began services with a gentleman that received 2-to-1 services. The agency quit because they couldn't get the health and safety waiver, and they left with 2 weeks' notice. This is a gentleman with autism. He's also a very large gentleman. We come into the home. We're still trying to get, and the health and safety waiver for us is about the pay for the staff that are doing a much more complex job than most. So the process of doing that, I think the median rate seems to be part of where we happen in the rate freeze, is the regional center is kind of stuck in, I need to look at this individual person and find the best services and supports for them, and the only alternative they have is to go through this cumbersome health and safety waiver process. So I know my team is trying to run numbers exactly, and what will you do exactly? So the wages will mean what? We need to look, and I know the regional minimum wage is a big issue, but for me right now, it's for people that are in crisis, because I am supporting 2 individuals. I am taking referrals. Thank you for July 1st. I said July 1st, but these 2 gentlemen are in crisis right now. They both need to have staff at a higher wage, but the health and safety waiver is not making it any easier. They didn't get them. We're going to try again. But I think if we lift the median rate, we lift the rate freeze, and we do what's right for the person, I think in the short run and the long run, we're going to save money, and we're going to, more importantly, serve the person's needs. And I really like your dashboard. I also think I received an audit from DDS, so I'm glad I was one of your numbers in your data point. But that audit is about money. It has nothing to do about quality and outcomes. And when we look at CMS and HCBS, it would be nice to have a dashboard that's attached. When you're spending this money, are you getting the outcomes? Because that's what really matters at the end of the day. So thank you.
Thank you. Final witness.
Barry Giardini with CDSA. Again, I'd just like to echo the sentiments about the reform for the health and safety waivers. Thank you.
Thank you very much. Appreciate that. We will hold this item open, but again, as outlined on page 21 of the agenda, we'll continue to look at these 4 bulleted areas that the committee feels will help improve oversight. That's, again, the implementation of a quality performance dashboard system, the reporting of consumer complaints, and requiring more detail in publicly available budget documents. And in all those documents, as we talked about, making them much more user-friendly and relevant. Moving on to issue 5, Fiscal and Program Research Unit. We're on page 22 of the agenda.
Thank you, Madam Chair. In this proposal, we're requesting $923,000 and 7 new positions and funding for 1 vacant position that we're proposing to redirect to develop a fiscal and program research unit. We receive a significant number of requests for data, not only from the public, from advocates, from the federal government, from the LAO, from the legislature. So, and we struggle to meet the timelines that people would like to see. It's difficult to get a lot of the data requests responded to in a timely fashion. So we think this unit will be helpful in doing that. The unit, we're expecting it to, do thorough analysis on fiscal and program data. We think it'll not only improve response times for requested information, but it will improve transparency, I think, on how funds are spent. And it will also improve data analysis for improved decision-making. I think those will be several of the benefits it'll provide. Whether or not we have specific metrics already designed for this new unit, we don't have anything specific in mind, but there are a number of areas that we already intend to focus on. We believe that a thorough review of service code expenditure patterns will be helpful in determining, where are we spending our money and what kinds of things are driving costs in those areas. And we also think it will be useful for things like consumer satisfaction to better understand what kinds of services are beneficial and what works. So those are some of the areas we're proposing to look at with the unit.
LAO or Finance?
Thank you, Madam Chair.
You're welcome.
As noted in your agenda, we are recommending approval of this proposal. We would note, as we've heard earlier, that good data and analytical capacity is needed for strong program oversight, and the department has had challenges in responding to requests. As such, we find the requests for additional staff and related resources is warranted, and we also recommend that the legislature consider identifying goals for this new research unit, as also outlined in your agenda. We have offered some questions to consider, including what data gaps exist and how could this new unit improve the collection of data. The request indicates that there will be a look as to what kind of ad hoc information the department currently collects, and notes in the request that the workload is intended to be mostly exploratory as they hire on staff. Other questions to consider in terms of what data analysis should the new unit publicly provide, as well as how it may interface with other state agencies critical to providing services for the developmental center or regional center consumers, including CDE, Department of Healthcare Services, Social Services, and others. And then finally, just how could this new research unit help support financing reform efforts? Thank you.
Has the LAO considered what kind of specific performance metrics as well that they should be reviewing annually?
We have not at this time.
Okay.
Thank you.
Great. Finance, anything?
Carla Castaneda, the Department of Finance. We support the proposal for all the reasons stated, but we'd be open to discussion on some of those goals for the unit.
Okay, great. Good to know. Public comment, please.
Rick Rollins with ARC Association Regional Center Agencies. We're very excited about this proposal and urge your support of it. We see it as a much-needed piece that, unfortunately, because of budget, we often think about budget reductions to our system at regional centers and providers, but the department over the years has also taken substantial hits along with the retirement and other reasons. We don't have the capacity to do what needs to be done. We think this appropriation will set up this new research bureau, essentially, that will be able to look at things like disparity, understand what we're finding in all the data that we are collecting, and also to do some planning in the future for the populations in our system. We tend to be very reactive in this system. It'd be nice to understand and to start planning ahead of the curve rather than being always behind the curve. Thank you.
Thank you. Next witness.
Hello, my name is Mark Pollitt. I'm a parent, and a parent getting up to talk about research and analysis. I want you to know that as a parent, that's very important for me, because I want to know that my son will be taken care of in the future. So the sustainability of the system is important, and also the quality of services that are developed. The Lanterman Act was originally founded on the concept that the market will sort of drive the evolution of services, and that's good to some extent, but over 40 years we've learned that that really hasn't worked well enough. So we really need smart management of the service systems and how it evolves. A couple of years ago, the legislature took an important step in passing the Employment First policy and self-determination program, which will lead to greater efficiencies in the system, as well as people being more included in their communities and more in control of their lives. So that's wonderful. But having the data, having the analysis, doing the research will help the department play a greater role in guiding the evolution of the system. And we need to be able to reward people who provide the kinds of services we want. And so this proposal is really important to me as a parent, so thank you. And it will also address things like geographic discrimination and disparity, as well as ethnic, et cetera. And I'm going to have to go, but I just wanted to say on self-determination, I really do appreciate the work the department has been doing on self-determination. They've shown a lot of leadership and sensitivity and has been working with us over the last 2.5 years. But it's been 2.5 years since the law was signed. And so we really have to find a way to dive to the finish line and really ensure that it happens. And as a parent, I can speak for parents that, we'll do our part and work on CMS when the time comes. So thank you.
Thank you very much. Appreciate your testimony. As noted on page 23 of the agenda, we're going to hold this item open, and perhaps the legislature will exercise our authority to pursue some of the items that are listed in terms of perhaps specifying additional metrics and analyses to go along with this new effort. So we'll hold this item open for now. Moving on to issue number 6, Federal Fair Labor Standards Act implementation.
Thank you, Madam Chair. In this proposal, the department's requesting $86.5 million. Approximately half of that is general fund and it represents an increase of about $54 million over the current year to provide the full year cost of implementing the Federal Fair Labor Standards Overtime Act. So the overtime related to this proposal is tied to services such as supported living, in-home respite, and personal assistance services. The agenda also asks for an update on where we are with the Fair Labor Standards Act and the overtime costs that we're seeing. And as you're aware, the budget originally proposed to have the act implemented in October of 2015. Given litigation, the funds were tied up and the department did not release funding until December 1st of 2015. So the expenditure data that we have right now on overtime costs is very limited. I don't know that we have sufficient data to make any kind of informed comments about kind of where we are with the implementation at this point.
Leo, Finance, any comments? Senator Monti, nothing? Public comment, please. Issue 6.
Sorry, Connie Lapin. This is a really important issue. As legislators, you can't repeal the law of unintended consequences. And this Fair Labor Standards law for people with highly complex needs and severe behavioral challenges has some real negative unintended consequences. It's not that we don't support overtime, we do. But with people with complex needs, in the community, and HCBS, the feds like these kinds of services, supported living and personalized services. We're talking, I don't think about a huge population here. I don't know if my numbers are right, but it doesn't seem like everybody's got the exact numbers anyway. So what I've been told is that 71% of our population live with their family, 29% live outside their home, and 13% live in care settings. So that might leave 8% in supported living and independent living centers. And of that percent, not everybody has high complex needs that needs 24/7 awake overnight. So we need a robust exception process, again, using the IPP and looking at case by case to see how we can support that person. we need to change the code so that the IPP will determine whether IHSS and supported living services is an appropriate generic service. I was at that meeting with the stakeholders when we were in funding hell, and we decided that's IHSS. So I support DRC's testimony. I also echo that SLS and IHSS should not be considered joint employers. They weren't in the beginning, and it was kind of shocking when that came through that maybe some lawyers or providers said, don't mess with this, but we would love some clarity on that. The person-centered advocacy partnership is doing pilots on trying to provide access to temporary workers because it doesn't just only hurt consumers, it hurts workers. People can't afford to live on 40 hours a week. And the same protections in IHSS and exceptions should apply to supported living services. I do want to see how these unintended consequences has harmed people and has not caused service cuts, dismantling of programs, and most important, the feds like person-centered planning, and I'll talk about that in later, briefly, but it takes the choice out of consumers. You have a consumer that has somebody that's been in their life forever, and they want to stay in their life, and they're working over 40 hours. And what providers have had to do is say that to cut it. And then finally, there are some federal laws that speak to this. The ADA requires states to create exception policy for those who face the risk, well, it's not any more institutionalization. Medicaid law has rigid, when you make rigid compliance in overtime, they could also undermine the new person-centered planning requirements that says that a person has the choice of who they work with. To avoid violating the Medicaid law and endanger health and well-being and Medicaid participants, the state may need to recruit additional workers. That's going to be a cost. And then finally, the December 15, 2014, there was a Dear Colleague letter from the Department of Justice and Health and Human Service Office of Civil Rights and said the ADA and OMSTED generally prohibit across-the-board restrictions and caps on workers' hours, and there must be an exception process. So there's a lot of eyes looking at this, and I know it wasn't meant. I know nobody intended to harm anyone, but labor was told there's an issue here with people with severe disabilities, so we have to address it. Thank you.
Thank you.
Madam Chair, Dwight Hanson on behalf of the Alliance. I hate to just be the historian all the time, but you know this law went into effect last October. The funding didn't occur until January, so folks were at risk, agencies were at risk for all that time. The money they were given in January was not adequate to cover the costs, and here we are in April. This is not the way to run a railroad, and this is not the way to run a rate-setting mechanism when you get these kind of crises. These agencies are strapped already from years of rate freezes. They simply can't take this. As a way of looking forward just a little bit, the president is about ready to implement a new law that requires all exempt employees to be paid a minimum wage of over $52,000 a year. If we wait for a year after that goes into effect, like we're talking about now, we're going to be right back in the whole problem all over again. So we need to get ahead of this thing. The discussion we had a few minutes ago about this process, it needs to begin right now. And maybe the first item has to be, how do you deal with unintended consequences and new ideas that come forward before they wash over us. This is washing over us right now, and it's going to hurt a lot of people. We can't afford to have another one. Thank you.
Thank you. Next witness, please. 2 minutes.
Yes. My name is Harvey Lapin. I want to speak on IHSS. I support labor. I was the organizer of a lawsuit in 2000, Sanchez, community care wage parity. But IHSS, as far as being a fit with supported living, I don't understand it. And I'll tell you why. Because there is no training whatsoever required, only a criminal background check. A lot of people with severe needs, dual diagnosed, in supported living, okay, could take 2-3 months of training of a support person. They don't have that in IHSS. Other states have, it's all Title 19 money. Other states, what they've done is that money went directly to the regional center, and they were able to do types of wages in things that would match up with CMS standards. And they in fact, they rewarded people that did things that matched and was for the customer. So my issue, there's got to be a minimum of exceptions, especially with all the training that has to be done on with certain people. Thank you.
Thank you. Next witness.
I'm Peter Carter. I'm the SLS director with Choices. I'm speaking on behalf of Nancy Chance, who spoke earlier a little bit out of turn. I'm here on behalf of Choices, who are members of the Person-Centered Advocacy Partnership. I'd like to briefly echo one of the earlier statements made by Nancy on how crucial it is that we need language confirming that SLS be in compliance with a 40-hour work week and not with an 8-hour workday. Thank you.
Thank you. Next witness.
Hi, my name is Jackie Dillard-Foss on behalf of the California Supported Living Network. The Department of Labor feds came out 2 weeks ago with guidance around this new FLSA law, and the joint employment language was clarified. So unfortunately, I don't know if the state can usurp what the federal government is saying. There was several phone calls, and I know that John Doyle and the Department of Labor talked a lot to the Supported Living Network, talked to DDS. I would love to have clarification. I don't know that we get out of the joint employment relationship because it would be a national change and not a state change from my understanding. So that would be one complication. The other one is when you look at the CMS and HCBS regs and you look at supported living services and you look at IHSS, IHSS is a task-driven notice of action. You will do this task. There's no outcomes attached to it. You will do laundry. You will clean the house. It's not about a person with a developmental disability. The other issue that I'm having is on the person with complex behavioral needs. If I have to access IHSS and I'm trying to fight for a higher wage for that person, I'm in conflict with two different wages all the time. But I've lived that life for 22 years now doing supported living services. It's getting more and more difficult. The other one on the overtime issue, supported living services is doing a 40-hour work week, and the 40-hour work week is they're doing at biweekly 26 pay periods. IHSS is still in the 24 pay periods. I have staff coming in all the time saying, I didn't get paid the right overtime because they're 1st to the 15th and 16th through the 31st or 16th to the 30th. I have so many confused employees that the turnover rate alone, people will quit because they have to access IHSS. They just leave. They say it's too complicated. I get a paycheck from you, I get a paycheck from them, and they could wait 2, 3. I just had a staff resign today because it's 6 weeks out and she hasn't been paid yet. So IHSS and supported living is a complicated relationship, and I'll say it again, this arranged marriage has got to end because we need to move forward in supporting people with developmental disabilities appropriately. And I think we also need to read the DOL guidance that just came out because it's more and more scary being an employer. There's days where I go, I don't know how much longer. So
Thank you. Next witness.
Evelyn Abu Hassan with Disability Rights California. I'm just going to touch on the comment that Connie made around having the IPP team determine whether IHSS is the appropriate service for a consumer or whether they need a higher level of skilled services, and let that IPP team process decide how to move forward. Also looking at ensuring that we provide funding to pay for overtime when overtime is triggered between the combination of SLS and IHSS. And then finally, providing funding to enable regional centers to backfill IHSS hours when the workweek cap rules cap provider hours, and the affected consumer is at risk of losing their authorized hours. So looking at those three components and ensuring that the consumer gets what they need. Thank you.
Thank you for that.
This is going to be easy now. Associate my comments with Jackie's because Jackie did that on purpose, I think.
That's right.
The other...
About where you get in line.
Yes, right. Darn it. And Evelyn just also talked about the supported living piece and how it's person-centered. And the Lanterman Coalition is one of our positions that we've laid out, and we want some authority, some way to address the issue to make it so that if it's not appropriate, that in the IPP you make the decision that in a particular case, IHSS is not the appropriate generic resource for the individual.
Thank you. Next witness.
Yeah, Rick Rollins with ARCA. I just want to do a Senator Mitchell ditto on what Tony just said. And again, ARCA is a proud member of the Lanterman Coalition, and we strongly support the letter that was submitted to you from the Lanterman Coalition.
It's all you.
Okay, I'm going to take the helm here for a few minutes. We're going to move to issue number 7, Home and Community-Based Services, Federal Requirements.
Thank you, Senator. I'm Jim Knight with the department. I'm going to give Mr. Doyle a break. So as noted in the agenda, there's recent federal regulations became effective that define new requirements for places or settings where services are funded by Medicaid or provided. And prior to this, there was really more of a focus on what a place or setting looked like, as opposed to these new requirements really focus more on the outcomes for people who are receiving the services. So to help address some of the changes that these new regulations are going to require, the governor's budget includes some proposals that I'll go through for you. First is $15 million to allow service providers to make changes or modifications in order to meet the federal requirements. This will involve providers developing a proposal detailing what they're going to need to do to meet those requirements and how it will result in improved outcomes for people that they serve. The proposals are going to need to be reviewed by both the regional center and the department prior to approval, and we'll be working with stakeholders to develop the specifics of this process and be able to provide guidance on that here in the near future, how that's going to roll out. There's also provisional, as noted in the agenda, provisional budget bill language that's going to require annual reporting on the number of providers that receive these funds. The budget proposal, there's another budget proposal that includes $1.6 million for regional center staff. There is going to be a significant amount of work that's going to be required at the local level to not only oversee this transition process, but also data reporting and working with local communities, providers, people who receive services and their families on these new rules and what the impact's going to be. Also, there is a proposal for about $483,000 for 4 positions at the department for workload that's going to be associated at the state level, not only developing our plan for what's required, but the implementation as well. We also have placeholder trailer bill language that's expressing the legislature's intent to timely implement changes necessary to comply with the federal requirements. Although there isn't the specificity available now, we did want to have this in place so that when we are ready to move, that we'll be allowed to do so quickly. As part of implementing these new requirements, the state needs to develop what's called a transition plan. It's referenced in the agenda, and that spells out for the federal government what steps the state is going to take to identify, number one, where we are in relation to the requirements, and also the steps we'll need to take to address any issues that are found. To date, no state has had a statewide transition plan approved by the federal government. Although we are working and meeting weekly with the Centers for Medicare and Medicaid Service in conjunction with Department of Health Care Services and other state agencies that receive Medicaid funding to work through the questions that the federal government has for us. So then after that, we have meetings actually scheduled through the end of the month. Pending how that works out, we'll still need to revise that transition plan and post it again for 30 days for public comment at least before it gets submitted back to the Centers for Medicare and Medicaid Services.
And what's the timetable on that?
He said the meetings are scheduled for until the end of the month, and we'll know more then.
So an approximate target for the submittal of the revised plan to CMS?
At this point, we don't have a target, and I know that there'll be another Department of Health Care Services also is going to be the lead agency on this, and be best probably to work with them on what that target will be, but I think we'll probably know more at the end of this month after the meetings with CMS are concluded.
Thank you.